Hi, my name's Todd Ellenbecker. I'm a physical therapist here at Physiotherapy Associates Scottsdale Sports Clinic. And I'd like to show you the tape job that we're doing with TheraBand Kinesiology Tape. It's part of a TheraBand Research Advisory Committee research project that we're doing to investigate the effects of TheraBand Kinesiology Tape on actual shoulder muscle function. The tape job that we're actually using involves 4 strips with TheraBand Kinesiology Tape. First strip goes on along the central deltoid. We actually stabilize the tape right at the inferior aspect of the deltoid. And one of the unique things about TheraBand Kinesiology Tape are these hexagons. And the hexagons actually allow us to, in a calibrated way, elongate the tape as we should as practitioners when we apply this tape. And so we're using the small hexagon, difficult to see on the video I'm sure here, but there's a small hexagon here that when elongated 25% becomes a true hexagon in all 6 sides. And so I'm placing the kinesiology tape here and then elongating it 25% and tacking it down. I then place a second piece of the TheraBand Kinesiology Tape along the anterior deltoid. You can see that we have our arm stabilized throughout the tape application with a pillow underneath the arm. So there's about 20 or so degrees of abduction in the scapular plane. The last piece goes on along the posterior deltoid. Difficult to see on the video, but again, I'm elongating it 25%, which is very, very easy to do with this type of tape because I'm just using those hexagons as a guideline. So the idea with this particular tape job is that it's providing stability, sort of superior stability, if you will. It's pulling the humeral head slightly up into the glenoid and providing stabilization. We use this oftentimes with individuals with multi-directional instability and rotator cuff pathology. Our last strip that we'll apply is often referred to as a posterior humeral head or humeral head relocation strip. So we're going to put that, tack it in anteriorly, and then come around the lateral aspect of the shoulder, and following the line of the infraspinatus, right underneath the spine of the scapula, we're going to go in a diagonal direction, tacking the tape down. We're going to pull the humeral head back in a slight posterior direction, if you will. And very obviously, we'll be retracting the scapula. We actually want the scapula to be in some degree of retraction. And again, we apply the tape with the 25% elongation. So we tack it down, we come around, we monitor our elongation all the way to the end when we tack it down to the skin. Now the premise for the research study is that we're actually using a Biodex isometric mode on the dynamometer to assess internal and external rotation strength. We do it both with and without the application of TheraBand Kinesiology Tape. It's a randomized study, so we're going to be able to assess both in injured individuals as well as normal controls to see if the application of the tape actually has any effect on individual strength.